You.
All right. Thank you, Zoe. Good morning, everybody. It is great to be here with you today. As Zoe mentioned, I am the Deputy Director, Chief of Staff at the Division of Mental Health and Addiction. And I have been at the division now for about, I think it'll be 16 years this September. So for those of you that have known me in other roles, that's been a very long time. And then actually, I've known some of you since before my work at the division, when I was at Choices doing system of care work for the child and adolescent system. And a little known fact, your very own George Hurd was my first supervisor out of college at Marion County Probation. So there have been connections for many, many years, going back almost 28 years now. So it's great to be here. My role now is more focused within the office and central office at Division of Mental Health and Addiction. In the past, I've had programs and budgets and done a lot more out-facing work and worked with communities. And so now with this new role, the way that we have looked at the division and really tried to focus our internal staff and our initiatives is that we have Jay Chaudhry, who's our director, and his main focus is our pillars. So when you think about at the division, the work we do, we have these main pillars, and those are addiction, substance use, prevention, and then mental health, and then our state psychiatric network. And so Jay really has supervision over those pillars and those main, in some ways, funding streams that we have that come into the division. And then when you think about all of those pieces, mostly behind the scenes, that you don't always get to see forward facing, that allow those pillars to work and be successful. So thinking about data, our quality improvement, our certification and licensure, our workforce initiatives, our work around diversity, equity, and inclusion, our forensic treatment programs. Those are all initiatives that are under me. And so when you think about those behind the scene pieces, those are the pieces that I oversee at the division and that I'm responsible for. So that also includes, I'm sure you've heard of our work around 988 and mobile response and the CCBHC, and all of that work now is all part of that foundation. So thinking of building that really strong foundation so that those pillars within our system, the mental health, the addiction, the prevention, and our state psychiatric network actually have a solid foundation to stand on so that they can be very successful. So that's a super quick overview. Zoe, was there anything else you wanted me to touch on, or you want to get into some of our
Yeah,
program?
so no, just some of the things that you said as far as behind the scenes, for members understanding,
Mhm.
even though it's internal facing, there has been a lot of external facing as far as with projects that we've been collaborating on. So one of them you mentioned is data. And then the other is the 988 mobile
Mhm.
crisis response and CCBHC. So do you want to share about your vision of how you'll be working with the council and all of us on this call regarding those things?
Yeah, sure, absolutely. So we have for our CCBHC, there's a recognition that that's a huge system project, right? That's going to take all hands on deck. It's going to take everybody, not only within the office, but also all of our provider networks. And so we have developed and are working under an OKR, objective key results process. And this is a process that's been around for a while. We've recently done it for our incompetent to stand trial initiative. So if those of you have been involved with that, you might be familiar with some of the processes. So within that, we have developed work streams. And those work streams then, as Zoe mentioned, there's one around data, there's one around workforce, there's one around treatment, we have communications, we have finance, which I'm sure is probably one of the most important in many aspects, right? If we can't fund the system, it won't be successful. And then there's also provider relations. And so we have these work streams, and those work streams are going to include internal DMHA staff. And when I say internal, I mean, it's not just our CCBHC team. So we have a dedicated team that will be focusing on CCBHC, but we also have Dr. Corey Carey, who is over diversity, equity, inclusion, housing, workforce, and our forensic treatment. She is leading the work stream on workforce. And so we're pulling our experts from other areas within DMHA to lead these work streams. And someone within the office will be a lead on each work stream. And then we will pull in providers and constituents and individuals in recovery, individuals with lived experience around mental health to participate in these work streams to make sure that we're getting a comprehensive view of what's out there and what's going to be best as we build up the CCBHC and mobile response system.
Great. Thank you so much for sharing that. I think that is definitely something on all of our minds as we have 19 pilot CCBHC, and really believe that CCBHC is the CMHC house of improving development and quality outcomes, finances. And so we're really all hands on deck to be able to do this alongside DMHA, but have quite a few experts already who have been doing it with the pilot. So really want to elevate that expertise within our state. So thank you. So share a little bit about, I know there's been several assessments and, work being done, with the council and the council members. What is the vision for those assessments, and how will that all interface with the work you're doing with CCBHC and 988?
Yeah, so there's the OSA, the self-assessment, and there's been other work around class standards, and all of that is going to feed into the work streams around CCBHC. So those reports and that data is going to come back to those individual work streams, and we will be reviewing that information to then say, what do we need to do to move forward to make the CCBHC the most successful project? And so not only will those be informing that, they will also be informing the Behavioral Health Commission. We have a lot of initiatives going right now that we are just going to use that information. We recognize that we've done a lot of surveys and asked a lot from our providers, especially it feels like over the past year or so. And so we are really trying to bring all that together and share that information as much as possible internally, so that we're not coming back to you asking for something and you're going, wait, didn't I just answer this question last week for somebody else? And so that is a strong initiative. We are really working on building cohesion and communication within our executive leadership at the division, so that we are all on the same page. And when you talk to one of us, it's like you're talking to all of us, because we are sharing that same shared vision and mission. And I know, we talk a lot about CCBHC right now and 988 and mobile, but we do have a couple other projects. And I don't know, Zoe, you want me to talk about those now?
Yeah, absolutely.
Okay.
That was my next question.
Perfect. Yes. And so some things that we aren't actually, they're not talked about as much, but they're, again, behind the scenes, just as important, if not even more important. And so one of those is updating our rules. So for those of you that have been around for a while, you know that our rules have been around even longer. And the language in them is very antiquated, very outdated, and sometimes confusing and contradictory. So we are working very hard to update all of our rules, and this is a project we've been working on for a couple of months. So it is possible that you will be asked, because one of the pieces that we've identified around our rules is there are programs like the semi-independent living program and the transitional living program that you all certify yourselves or verify for yourself. So one of the questions we're asking is, do we even need to have those in our rule? And what does that current network look like out there? And so it's possible that you will have someone reach out to say, hey, do you have these locations or these networks within your system in which you're providing services to folks, and what does that look like? And one of the reasons we're asking that is because we need to know, do we need to continue doing what we're doing? Does it need to stay in the rule, or do we just need to take it out of our rule altogether? Or do we need to bring it back in and start certifying it again? Not sure that's the best answer, but that is definitely one of the questions. So you might hear more about some of those independent living and some of those other certifications that you don't currently get certified by DMHA, but you certify yourself. The other piece that we're working on is our mental health disaster response teams. So I know that some of your agencies have been involved recently because of the tornadoes. Esther Stone Cipher, I don't know if you all have met her yet, but she is our emergency preparedness person at the division. She's amazing and probably one of the most organized people I've ever met, which makes her very good in this role. And so she has just recently hired 5 contractors that are going to start reaching out to some of our networks to do some digging into assessments around what is happening around the disaster response space and what does that look like, and updating policies and working on our state response plan. And so this is one of those things that you never need it until there's that disaster, and then you're like, wait, what do we do? And so she is really working to help get our network ready so that when there is another disaster, that we just automatically go to this plan and say, okay, this is what we need to do. We're ready. We understand this. So it's possible that you will hear from her or from one of her new contractors. And then we are also updating our peer curriculum. So we have heard from many individuals that there are some barriers with getting folks certified and through the training to be certified peer specialists. We know that this is a huge priority right now, especially with the expectation that peers be involved with mobile response teams, that they're involved in pretty much every aspect of our system at this point. And so we are in the process of updating that curriculum. By updating, I mean we are revising the entire process. The curriculum historically has the DMHA curriculum has historically been more focused on mental health with a couple of hours around substance use disorder and or addiction. And then folks have historically had to go elsewhere to get a certification to become a recovery specialist. And so what we are doing is we are combining that. So there will be one training, one curriculum for an individual that is in recovery or has lived experience to get training and then become a certified peer. And then that certification will allow them to be employed and work under any of those initiatives that we are building. Now, the one exception to that is the crisis peer training, which is a separate training that folks will have to take in order to be certified to be on the mobile teams. But when it comes to hiring peers, getting them started in the work that you all are doing, in the work around our recovery hubs, all of those spaces, we will have that one curriculum and that one training. We are hoping, the goal is to roll this out come July with trainings. The funding for all of this is covered by the state at this time. And so our plan is to allow this training at no cost to individuals that want to become certified as peers. And the training should roll out middle July, and then we will have one agency that's doing all of that training for this first year. Now, understand this is a new curriculum, a new process. There's a new certification, a new exam. So we do expect hiccups like anything else that we roll out. But we are really excited about this opportunity because number one, it's going to open the door for more people to get trained and for them to walk out of that training with more confidence in their ability to do the work, whether they are walking into a mental health facility and a substance use addiction facility or both.
That's great, Becky. I know a lot of people on this call have paid that concern forward regarding being able to get peers in, since we believe that that is a pipeline to our workforce. And so That's great to hear that update. And hopefully as that training and everything gets developed, you can share that so that I can make sure, even if we need to do, a webinar just around that of how people can get plugged in education for folks. I think that would be really beneficial. And then also, just so all of you know, Esther will be at our July member meeting as part of our 988 update. She will be part of that team sharing the work that she's doing around disaster response. So you'll get a chance to meet her in Muncie. We've dedicated an hour and a half to 988 because there is so much that's going on with that. And so we'll have that whole team from DMHA there to provide those updates on the waiver, and then also on service delivery and on the disaster response. So thank you, Becky, for sharing those. Anything else that you wanted to share that is going on behind the scenes that we might not all be aware of?
Definitely. So, and I think there was one question about the training, whether it was going to be in person, hybrid, or remote. And we're still working out those details. We, as you can imagine, it's a hands-on training. So ideally we want it to be in person, but we also understand that's not realistic for everybody. So those are some of those last minute details that we're going to be figuring out. We will take all basically barriers into consideration, I guess, because we do understand that sometimes it's hard for folks to get there. So if it has to be in person, we expect that we will be the ones to travel around the state to do it, as opposed to making everyone come to Indianapolis. That's not the intent. So hopefully that helps you to feel a little bit more confident in that. So the last thing that I would just share, early this year, the executive committee got together and we talked about, what are the major focus areas, our major priorities for DMHA? What's that center? What's that piece that we come back to say, does this fit within our priority areas? And we came up with 3 main areas of focus, which I'm sure none of them will be a huge surprise to you. One of them is to grow workforce. We recognize that without a qualified and independent workforce, we can't do this work, right? So we need folks that are out there, that are licensed, that are certified, that are able to do this work. And as Zoe said, we need to grow that pipeline. So not only for peers, but for all of our workforce. And so that's a huge area of focus for us. Building infrastructure is the second. And I would say that, as you can imagine, that is really focused around CCBHC and 988 and mobile, and how do we build this infrastructure so that we have this web of services around our state. So it doesn't matter where you live, but you get access to the same. And then the third one that goes along with that is enhancing quality, which in many instances is not necessarily even needed to be stated. That should just be an expectation. But we wanted to make sure that we put it forefront, because we want to make sure that the quality of our network is there, so that there is consistency. No matter where you go in our state, you're going to get access to the same services and supports. So those were the 3 areas of our focus: grow workforce, build infrastructure, and enhance quality.
Wonderful. Well, that is a lot of our focus too. So that alignment is there. And so now I think it's a perfect opportunity to open it up for questions from members. We have about 50 folks on, and this is your opportunity. And Beth, I see your hand.
Good morning, Becky. It's good to see you.
Hi,
I just want to thanks so much for being here this morning, and really appreciate everything that the division has done to communicate with the community mental health center system. I want to go back for a second to the work groups that you all are developing around CCBHC. And I have a concern. I don't know if it's real or just not. But, I think part of the reason, there are a lot of things that can be improved with the CMHC system, but it is a system. And I feel pretty strongly that the only path forward is as a system. And so I do think that the CMHC group is really the most qualified and ready to take on CCBHC. And I have a little bit of a concern. I guess my question is, I just want to make sure that there will be CMHC representation on all of the committees.
Yes, absolutely. And Zoe actually sent emails this week with recommendations to our work stream leaders. And so we are including our community mental health centers in all aspects of this. And, you know, the expectations and requirements for CCBHC are vast. I mean, they are big, and it's going to take a lot of effort and a lot of internal infrastructure from the provider network to be able to be successful as a CCBHC. And so we do see our CMHCs as the forefront of that, you know, as the ones that really have that foundation started. At the same time, and maybe Beth, this is getting to some of your concerns, you know, we also don't want to limit the opportunity. If there's someone else out there that has the capacity and the capability to be a CCBHC, we don't want to limit that opportunity to only our CMHCs at this time. However, we also recognize that you guys are the foundation for that. And so our goal is to support and build the network, focusing on the CMHCs, but also keeping in mind that it's possible there are others out there that could come alongside and do some of that same work.
Yes, and just so everybody knows, Chuck, I see your hand. The work streams were divided up by the groups that were financial and clinical operational that worked on the legislative plan to keep that consistent. And so the finance folks I gave to Ari, and then divided everybody up that was on that group to various work streams, just, you know, really based off of areas of expertise that they showed during that legislative plan. So those are all submitted, and you should be hearing from DMHA on that. I will be emailing you individually as well to that work stream so that it's not a surprise. So Chuck, I see that you had a question.
Yeah, thank you, Zoe. Thanks, Becky. Appreciate your ongoing collaboration, and also appreciate your willing to be transparent over the years, and glad to see you in this role.
Thank you.
I really I guess I want to add to what Beth's comment is, because I've heard this numerous times, and I was hoping maybe you could enlighten me, because when I look at CCBHC and the infrastructure, and I really, as Beth has said, I really see CMHCs as really that system network. And most of the CMHCs have, you know, probably 80 to, you know, to all of the services present that you're looking for in the CCBHC model. And yet I continue to hear at times, well, and I understand you don't want to limit yourself, but can you give us an idea of who else even is out there that would have anything close to the current model around what community mental health centers have when you look at the full continuum regarding CCBHCs? Because I think the more we know that and understand that, it helps us do a self-assessment on ourselves and really kind of a SWOT analysis to see where our strengths and weaknesses are as a system, and really opportunities. And of course, with every SWOT, there are threats. And I think it's understanding that. But I almost feel like you guys are playing your cards. I feel like I'm playing poker with you, honestly, on this. And instead, I want to make sure we're always collaborating. And maybe you can't be that transparent, but I keep hearing this, well, we don't want to keep it close because there may be others out there. If you could at least give us an example of that, because I don't know, I've been in this industry probably too long, but I don't see really any others out there in Indiana.
Yeah, so thanks, Chuck. I don't necessarily want to throw names out there, right? I think that we've all been around long enough that we know who some of those key players might be. We know who the providers in our communities are. And I would say all the pieces that you mentioned, Chuck, we should be doing that regardless of who else is at the table. You know, the self-assessment, the SWOT analysis, all those pieces are going to be required for us to look and really focus on in order for us to be successful at CCBHC, regardless of who those other folks are. And, you know, the only reason why we say that, we recently, the SAMHSA had the grant for CCBHC, and we had some non-CMHCs apply, and I don't know honestly who those folks are off the top of my head. I know that there were a handful. And so I think part of the waiting game is we're also waiting to see what SAMHSA does. Does SAMHSA pick any of those folks? Do they think they even have the capacity to do some of this? And so some of those pieces, as we continue to move forward with our work streams, I think those pieces will come out. Again, we are not focused on a current provider or a current network to say that we can only do this. What we are focusing on is what is the future state and who wants to be part of that process to help us build our future state. And that future state is the CCBHC. And we truly believe that our CMHCs are the strongest partner for that. And so we are hoping that all of you come alongside with us as we build this out. But our focus is really on what does that need to be? What are the certification requirements? What treatment needs to be included? What are those finance with the PPS and the financial rates? We are really focused on that. And so, yeah, so I don't know that I want to be that transparent, and I don't even know if I could. I think that my guess would be as good as yours as I look around the network to see who's out there, who's possible, who could do what. I think it's mostly right now curiosity of who could do it, not necessarily knowing I know so-and-so could do it that's not a CMHC.
Well, and also just to kind of echo that, Chuck, you and I and a couple others were on the Hospital Association call yesterday, and we've been on the FQ call and trying to, and so, for our CMHC system, we believe that CMHC is the CCBHC. However, designated care organizations with those hospitals or with those FQs and how we can expand those services to really develop that ecosystem is really the strategic vision that I've had when I started down this journey with CCBHC as well as our members. And so just keeping in mind that designated care organization might be the better fit than maybe allowing somebody to fully do CCBHC. Also, if they can't deliver CMHC standards that we have currently, they're not going to be able to deliver CCBHC. And so that's the, constant, I guess, foundation for me on that. So any other questions for Becky? Because I know we're hitting at the half hour. Like I said, we could talk with Becky all day. And so any other questions before we do our wrap up? And we can go a few minutes over since it is Becky.
Say, I just want to know, listen to whatever comments is being made here recently, and then some of the things that we have heard as far as some of the individuals who wants to get involved with CCBHC and that. I'm concerned about the watering down of community mental health centers. I mean, that concerns me very deeply. So if that can be addressed by Ms. Buhner, I'm here listening.
Yeah. So I think so the watering down of community mental health centers, that's the concern.
Yes.
Yeah. So I think I am understanding what you're meaning on that. So as far as we see the community mental health center, I mean, they are still that safety net. They still have those expectations at the federal and state level. And so community mental health centers, we don't see that expectation changing within any time frame. I mean, as we are, for example, rewriting our rules, we don't see that expectation for safety net and all those pieces changing as we write our rules. And so I don't know if that answers your question, Mr. Burks, and helps you to see that. So as far as CCBHC, this is a new set of standards that will be laid on top of and alongside the CMHC expectations. But we don't see the safety net expectations for CMHCs changing.
Yeah, well, I understand it, and I appreciate what you have done today, the information you have provided us. But it just, I have this alert in reference to as the watering down, and I'll stay tuned to see what is going on as far as we move toward a CCBHC umbrella That's how I look at it.
Yes, thank you, Mr. Burks. And I appreciate that and having your team there. So thank you, Becky, for your time. Thank you for your collaboration. And thank you, as Chuck said, for your transparency. So I held my breath when the position was open because I didn't know who we were going to get. And I know you're not supposed to base things off a position, but I exhaled when I found out that it was you. And I know the work that you've done in our state is about elevating services to provide services to the mentally ill and those with substance use. And I know that you have a support system here on the phone and through the 24 members, and we are in lockstep to deliver those services and provide the best level of care. So thank you for your great work. Just a reminder, real quick, guys, the Medicaid unwinding. I know that's not under Becky's umbrella in particular, but she has been very helpful in that communication. There is an update, a stakeholder meeting today at 11 a.m. I know that that has been very impactful statewide to those that we serve. So if you would like to get an update, I sent out that call information to CFOs and CEOs as a reminder yesterday. And then wanted to also remind you that open office hours with me is on June 26th. We have several active committees that are aligned with DMHA's work group alignments that work streams that Becky shared with you. And so if you're not plugged in to one of those committees, please reach out to Denise so she can get you plugged in. Two that come to mind that are fairly new is data analytics and our CCBHC mobile assessment. Both of those committees have DMHA attending regularly. The other one that fits to our priority and DMHA's priority is workforce. And the Human Resources Committee has made the decision to go monthly because DMHA has hired a director who's doing a lot of work and she wants to work in lockstep with us. So if you are within HR or want to be a part of that HR committee, reach out to Denise, as well as our Racial Equity and Leadership Committee. If you have diverse staff and you can plug them into this group, the work that they're doing through the Classy assessment with DMHA, and then also ongoing education and professional development, I believe is a workforce retention strategy for all of you. So if you don't have people plugged into that, please get them plugged in. It's a phenomenal committee and you can reach out to Denise on that. Our July Cup of Joe is not on July 4th because I will be in Orlando watching my daughter dance. But it's on July 11th. So because of the 4th of July holiday, that will be Trevor Rhodes of Medicaid. So please join us for that. And then of course, you've heard already our in-person member meeting is on July 27th. It will be focused on youth services, but we also have a pretty large section dedicated to 988. July 28th will be CMHC member only, where we will be talking about future policy for county and fiscal. And so if you can be there, please register via our website. And there are a lot of other updates that I will get out for folks, but I wanted to get the Starbucks winner out. So let me see who my random drawing is. Diane Young. Where is Diane? She's still on? She's not, she left already? Okay, well, we'll let her know that she won the Starbucks gift card. And so then in typical Cup of Joe fashion, and man, we just are over by 6 minutes. Raise your cup. I appreciate all of you. Thank you, Becky. And if there's anything that you guys need, please don't hesitate to reach out. Cheers. Have a wonderful day. Take care.
Thank you.
Thank you.